Good afternoon. I'm Al McFarlane. Welcome to the Friday edition of Conversations with Al McFarlane. On Fridays, we try to focus on health and wellness, and pleased to have friends and colleagues here, people that I work with who are both health professionals and media personalities like myself, all committed to educating, informing, supporting our communities as we deal with and deal through and past the pandemic of COVID-19 and also the pandemic of racial violence that our community and our country experience right now. I'm pleased to have my colleagues who are working with me on the African American Child Institute, African American Child Wellness Institute project to address the issue of crisis counseling that families and people need, especially children, during the COVID-19 pandemic. With me is Sherlyn M. LaChapelle and Daniel Plunkett. Sherlyn LaChapelle is a nurse practitioner, also a business person, a community organizer, an activist in every sense of the word. In fact, she is also a candidate for city council in the city of Maple Grove. We'll talk about that as well. And also on the team, both associated with the African American Child Wellness Institute, Daniel Plunkett. Daniel Plunkett is you have to tell me what your profession is, the right title for it, Daniel, but a licensed social worker. Is that the right title for your work?
Nope. So I'm a psychotherapist. I work with Brackens Consulting and Psychological Services and the African American Child Wellness Institute. So just psychotherapist, therapist, counselor.
Great, thank you. And I'm going to ask you to explain all that because that's part of the challenge and part of the mission is that this work that you do around mental health is still exotic even to us. So we need to have enough conversation about the particulars of what therapy means and what psychotherapy is so that our community is comfortable, can embrace the value that you public servants, that you health professionals can bring to our community. Well, joining me also is my colleague, Carmen Robles. Carmen Robles and I do a program like this frequently and sometimes alternating with this program. That program is called Conversaciones con Al McFarlane and Carmen Robles. And we talk in Spanish and in English. Carmen, I say, has connected me to my Cuban roots more than I had been. I just hadn't paid attention. But we have talked about the whole notion of Afrodescendientes, the African descendants. And there are more people of African descent in the Caribbean and South America than there are in North America. We who grow up as Black Americans and African Americans often think that we're the center of the world and that our story is the only story, and it's not true because there are many more of us, our cousins, sisters, brothers, our kin folks in the Caribbean, in Mexico, in Uruguay, in Colombia, in Peru, Brazil, all over the Americas, and we have to begin to recognize that. And as we recognize that, we unify, and we discover that there are no boundaries that can separate us. So we have a common vision, a common mission, and that's liberation of the human being, the human mind, human spirit, health and wellness all around. So let me do this. First of all, we've part of our project with Dr. B is creating a marketing an awareness campaign. And I want to share with you and to our viewers for the first time, a new ad that is appearing in Insight News and will appear in the Spokesman next week. And it's an ad promoting the work of this project of the African American Child Wellness Institute. The theme, protecting the mental health of our children, is our top priority. And Dr. B's catchline is, wearing a mask won't kill you, but COVID-19 can. And we describe what the Institute is, the mission of the Institute, and say that the Institute specializes in providing services that address trauma and exposure to violence using evidence-based strategies within the context of African-centered wellness model. and we want to connect people to a website for the Institute. You see it there, and also connect them directly to the Minnesota Department of Health to get more information about COVID-19 prevention. So it's really cool that we have this opportunity to bring these technologies and resources to the public. Sheridan, let me start with you. Background us, if you would, on why it's so important that our community talk about COVID, how we are impacted by it, and what we need to do to ensure that our interests and our health and well-being are front and center.
Well, as we know, it's been talked about on all news media that the majority of the people who are dying from COVID-19 are Black and brown people. And in fact, even more Black people than brown. They don't really understand the why of this. But it's important that we understand and stay off those sites on the internet that are full of lies and misconceptions. And no, it is not 5G. It is not the other stuff. This is a real virus that does kill. And I was reading this morning something from the University of Chicago. They just released a young man a few months ago. He was 10 years old. And he came to the hospital not with the lung breathing problem that we hear about all the time, but he just kind of passed out. And his legs gave out under him, and he was just lack of energy. So they called the ambulance and quickly took him to the University of Chicago. And they found out that the kids who've been dying have been dying from something called multi-system inflammation. And what that is all the organs in the body become inflamed. And the vessels around the heart get enlarged to the point of they can't maintain a decent blood pressure. And they have sometimes system failure where the heart fails, the kidneys, the liver, or what have you, and they die from that. Mm-hmm. Well, they thought this was just something that kids get. Well, they found out that some adults who have been having no respiratory symptoms, having these red spots and different things happen, and then later on they have some neurological thing. They might pass out, their legs might not function. They are being struck with this variation of the COVID-19, and they're calling it multi-system inflammation A, adult, and the other one's multi-system inflammation C for child. So this is showing up. So this COVID is no joke. We don't know all of the variations and all of the ways that it not only will kill, but it will affect your life indefinitely and maybe forever. So we need to pay attention, and we need to take this seriously. And if all you've got to do is social distance and wear a mask, that's like playing Russian roulette not to do it. I don't think you have good sense if you wouldn't do that.
Mm-hmm. Mm-hmm. Daniel, talk about the crisis element. How do we address the communities, families that may experience crisis from this pandemic or others? What are we talking about when we talk about crisis intervention or crisis counseling?
Yep, so there's sort of a few areas where mental health crisis might come into play. One is grief and loss. There are quite a few families that, are you able to hear me?
Yes. Yes.
Okay, all right. There are quite a few families that have lost, including myself, lost family members to COVID. So that immediate grief and loss is there for families. In particular, it's harder for kids because a few of my kid clients, they aren't able to really process this experience, but what they do know is that they see their family, their parents and grandparents grieving, and they're not fully able to make sense of it. And so that's one pocket of people that have direct impact. Then there's that.
Let's stop there for a second.
Okay, all right. Yeah.
How is grieving different? Because I know I had cousins die in London, and the normal funeral might be, a week at the outside, 8-9 days, but they held the body in laboratory or something for almost 6 weeks. And the holdup and I didn't get the details, but it had to do with the COVID-19, crisis, how it was impacting not only the handling of that body, but the
Yep.
entire system and process. And so what does that mean for the daughters and the grandchildren of that cousin who died? How does the grieving process become impacted as you're talk more about that? Yeah.
Yeah. So for one, so even prior to my cousin passing away, my grandfather passed away from Alzheimer's, and so with that, we have social distancing rules. People were it was limited amounts of people that could enter and come and go, and that is impactful, and can be somewhat traumatic because it impacts how we close our chapter with that person. And that's hard, and especially for the younger you are, being able to make sense why I have to stand in line to say goodbye to my grandfather, or I'm not able to console my family members. Like for me, it was really bizarre that my family, we could not console each other because we had to social distance. And so then for people like with family members, like you mentioned, how you don't know how long that body might necessarily be held. You don't know if you'll actually be able to do a traditional funeral. Cremation becomes complicated. Burial is limited to X amount of people. All of that stuff is really hard for people to manage while they're still grieving. It's just that added layer of stress and anxiety, because we don't get to say goodbye in the normal way that most people are used to. And then you also can't console and comfort people the normal way, because we have to basically pull out a yardstick or 2 yardsticks and say, this is where you can stand, this is where I can stand. I feel and I hear you, but I can't, we can't do what we normally do to comfort people.
We normally hug. We hug and we kiss.
Exactly.
Yeah, we can't do it.
It's bizarre to see someone crying and I can't go to you.
And so that's an extreme, but let me give you another example of the impact. I'm going to ask you to help me understand the outcome of this. So when my grandson comes over, Bobby and I, my wife and I, we sit on the deck of our porch out in back. They come to the backyard. They got chairs in the backyard, the griller. So Big Red's, Batala and Little Red are in the yard. He's got his bicycle, his scooter, his little car, and all the things to play with. So we can look at him play, but we can't hug him.
Can't touch.
Can't touch him. And so that's really hard. And you want to, and he's growing. He's all summer long. We don't know what's going to happen with the winter. It's cold now, so it'll be less likely to be out as freely as we were in the summer. But what kind of impact does that have on me, an adult, number one, a granddad? And what kind of impact does it have on a 5 or 6 year old child and his parents? And what can and should we do to not have that I don't know how you describe it, but have bad effects on us?
Yeah, well, so communication is, like they say, communication is verbal, nonverbal, but it's also part of it is physical touch, because there are some families where a person may not necessarily say, oh, I love you, whatever. But if you hug, you have physical touch, and you're like, my dad may not say he loves me, but if I did well at the end of something and they hug me, that means just as much as words. So that is, I would say, it can either be a primary or it could be sort of the secondary backup language of communicating with people. So I could see for you and for your grandson, that could be the most difficult part, because sometimes like touch can indicate what our words might miss, because not every generation, not every family, not every culture is practices saying and communicating verbally those emotions. So it is missed. So it is missed. And what was the second part, Al? I'm sorry. What was the second question?
Well, that was it. So let's deal with the question of how children are impacted. And we had two models here. One is in a funerary departure situation, but also I brought into it where it's not a question of a life and death at the moment, but it's a question of our regular relationship, right?
Yep.
How does a grandpa, Al and Bobby, grandma and grandpa connect with their children and grandchildren in ways that maintain the tie? And we feel some kind of way about not being able to hug them and not being able to, pat them on the head, pat them on the back. There you go, help them with the bicycle. And so, how do you, I guess talking is the most important thing, So that was, I was asking you about that, but you were going to talk about more areas of impact of a crisis.
Oh, yes. And so I got so deep into that part that I almost lost my track. But no, so basically for crisis, and like I think I mentioned this the last time we met, it really does intersect with every other part of life. So that's where us as crisis counselors come into play, because it does impact work, social situations, finances, education. And I don't think we all necessarily think about this. Like for some first year college students, this is a very significant experience. You don't get to start college the way that I got to, the way that most people got to, where you had a week 1 orientation, you moved in, you met people. It's virtual. And if you were fortunate enough to move in, you have significant restrictions. My cousin went to, she's a first year at Prairie View, and the restrictions they have are significant, and it's not the full experience. So, not be able to socialize with people, sort of congregate, meet people organically the way you will. And it's the same way with work. Some people are furloughed. Some people are just lost their jobs flat out. Example I gave last week, some people work from home, which is a whole new beast for some people, because that comes with a lot of additional tasks, especially with kids doing distance learning. It really does hit us in all areas of life, and we don't necessarily realize that. We feel the stress and the anxiety, maybe depression, but it doesn't necessarily resonate with us why we're feeling this way. And that's sort of like the role of us, is to help people unpack maybe why, because we don't necessarily see that. If that
Carmen, let me have you jump in for a second just to talk about, because you work with Jóvenes de Salud, young people who are working on health in the Latino community. And, the Latino community, the Afro-Latino community, impacted like everybody else is. What's the story? What are you hearing? And how are families negotiating and navigating, trying to maintain sense, of the world when we are besieged by crisis after crisis after crisis?
And I definitely agree with our colleague here. Thank you for sharing that information, because we don't hear it, and we're getting to the point that it's okay not to talk about it. Latinos don't talk about it. We talk about everything else, what someone else is doing, but not what's happening. And so my own family, Puerto Rico, dying, not being able to reach out. My grandchildren in Portland, Oregon, I won't be able to even look at them. So I'm dependent on Zoom, and the internet giant owns me. But that's another story. But I think we're all suffering together, and just like my African brothers and sisters, we want to help each other. And so you see somebody who said, we don't use words. Words destroy us. We use emotions. We give the look. We take out the chancla. You know what the chancla is? The slipper, bam, And so we need that. And we go to school, we don't know English, and then everybody's talking, and we go home. That's when abuelo hugs us, or daddy, like you said, pats you on the back. That's good enough. That says, I adore you. You're number one. And so we don't have that. We have to use words. And so words get lost. And we're turning more, I think, into the spirituality of it. into the miracle end of life. Like Tupac said in his poem, a rose grows through cement. And so I think Latinos are very much like that, like our African ancestors. That's how they survived the ships, and that's how they survived everything, was through, it wasn't through words, right? It was through sounds, it was through food, it was through something else. They couldn't use words. They weren't allowed to read or have anything that would give them words. And yet look at us, you know, we all came from that. We're all standing strong, resilient. And I think that's a conversation we try and do. Use our essential people like our sheriff's office to deliver information to the community, because I'm not going to do engagement anymore. And so how do they get that information? We partner, you know, the people that are out there doing it, like yourselves, we want to help you. You know, can we bring our bilingual information to you? And can you help share it? We've got 554 kids without parents now that are locked up in cages. And so that's another trauma based on our community, and the trauma of immigration and papers, and you're not an American, and it's trauma after trauma. But then we come together with individuals like yourself who are passionate, who carry the torch, who believe in justice for all. And that's what we cling to, that one little rose. So I don't know if that answered your question.
No, it's all conversation, and that's excellent, Carmen. Thank you so much.
And I thank you all for sharing that, because that's how we get our energy to go and do our job.
And Sherlyn, just come back in with, you know, the things we need to be saying again and again and again, and the number of ways we can say them and show them and be doing to model what the solution is. What do you think?
I think, well, I'm gonna tell you what I do. When I'm in the store or somewhere and I see somebody with their mask down under their nose, I said, you know, COVID goes up your nose. I said, you can also spread it that way. And I don't think you want to get COVID, because you'll no longer be able to be hanging out here having a good time.
Wow.
Because you'll be in the ICU suffocating. And for those of us with asthma, by the way, I have asthma too. You're telling me you can't wear a mask, you're wearing that shield thing? Well, the virus goes all under that shield. You need a mask with your shield. And I've worn a mask for 12 and 16 hours in the ICU taking care of heart transplant patients and in the OR. So yes, you can. You're not wearing it for 12, 8, 10 hours. You wear it for an hour or two, then you go back home and you get in your car and you take it off. These are all weak excuses, but I guarantee you, when you end up in the ICU, unable to breathe, if you think it's difficult with a mask, try not being able to breathe at all. Suffering.
Wow. What do they respond to you? What do they?
A lot of them pull that mask up. That's before I go into that, you know, people have had blood clots and they've had to cut off limbs, you know, legs, arms, just because they, you know, weren't protected. But, you know, everybody's got the freedom to do what they want, and it's always up to you. So that if and when you end up in the ICU, this is something they're probably lying in bed thinking about as they're struggling for breath. And that gives them a little something to think about when you're trying to be cool versus trying to be safe. I choose safety.
Well said, thank you.
What kinds of protocols do you recommend? So you go out and you do your weekly rounds to the supermarket, you know, and to the places you got to do, gas station for your car. What do you do when you come back home? Some of my friends say when I walk in the door, take off my shoes, or either use some kind of a solution or towels like Kleenex wipes, Clorox wipes, to wipe the bottoms of my shoes off. And then I leave them there, but I make sure I don't track the outside into my house. And then some will say, you know, I'll change clothes right away, take a shower right away, and then resume my in-house, you know, life. Or some will say, I'll wait and just shower in the evening before I go to bed. What do you recommend? What kinds of things are people doing? What's practical and what's real and what's recommended from your point of view? both Cheryl and Daniel?
I say, well, we take our shoes off and leave them in the garage anyway. My daughter-in-law is Asian, so you understand. So we've been indoctrinated for a long time. But inside my car, I got a can of Lysol spray. I have some hand sanitizer, and I have some bleach wipes. So the minute I get in the car, I spray everything. You know what I mean? You know, that kills stuff. You know, I spray it. I got about 3 cans in the car. Okay, I might have to take 2 out because they might freeze, but I'll leave 1 in. But I mean, I spray down everything, and my clothes, I give them a little spray too. Then I go home, and in the bags, I spray them before I take them out of the trunk and take them in the house. You know, you can wipe down things, but I spray them, because the virus can live for several hours, on surfaces. But we use a lot of Lysol spray here, a lot.
Okay. Do you change clothes right away when you walk in, or what's your clothing routine?
You know, I haven't been doing so, but I do spray my clothes down, I spray myself down.
Okay.
And I know people think that's kind of paranoid, but I spray myself down pretty good. As soon as I get in the car, and everything is kind of wet for a minute,
Yeah.
Yes, well, be paranoid because you're a fabulous nurse. And
Thank
without
you.
these essential workers like yourself,
First
I
responder.
shudder, I shake. So, and I'm a breast cancer survivor, and I owe my survival to you folks. So I love you. Keep spraying.
Daniel, what do you think? How do people come up with protocols and families to both routinize, activities that keep them safe and keep them, where they want to be without becoming over obsessed or over, like OCD? And maybe OCD is the right way to be. I don't know. But what do you think? How do you adapt?
I think a lot of the stuff that like Cheryl Lynn mentioned is stuff that prior to COVID, we should have just been doing in general.
Right.
I think the biggest part is for families is it being modeled and being consistent.
Okay.
Because it's one thing for a parent to say, do this, or a caregiver, provider, do this, and this. But if the kids don't see the parents or whoever it is doing this, and this, how do I feel compelled to do the same thing? So it's like, okay, we're all going to go in. We just came from outside, take off our mask, drop them in the garbage if they're disposable, wash our hands. Then we do this. We're all going to wash our mask if they're reusable ones. It's about that consistency and modeling. And that's just not only with issues around like health, just in general. Cleanliness, and things being modeled. Because, I come from Chicago family via the South. Do as I say, not as I do. And it's like, wait, this doesn't always work out.
Hey, you're Puerto Rican.
A few of my family members actually are.
Told you so.
A few of my cousins. But like, it's that modeling. Kids nowadays too are just like, wait, you don't always wash your hands after you do this. and some are smart enough not to say that. But like, like kids notice that stuff. And so if it doesn't become a learned and acquired behavior, then it's not going to be done consistently. And that's what they need to know. It's the same thing with social distancing. Helping people learn for now what are healthy physical, like literal physical boundaries. You just have to do it for now and be able to explain, this is the reason for us doing it. Again, it goes back to not just doing the do as I say, not as I do. Because if I see my family hanging out and they real close to people, I'm like, well, I'm not taking this as seriously because you're not.
Right.
And the thing is, you can't blame younger people or other family members because they're doing what they see you do.
Exactly.
So it's like I said, modeling and that consistency with all of with sort of protecting their health and also like their physical beings.
And we want to connect with humanity, you know. I mean, it's an invisible power that pulls us to each other.
Yes.
And so we have to be conscious that for this time being, we cannot be pulled to each other. But it's like breathing or blinking. You don't know you're doing it. And so it's very hard. Yeah. But thank you for reaffirming that.
Yesterday, with a couple of guys that work for me doing the delivery of insight at the end of your shift, they came by and sort of do the report on what's going on. And at the end, one of the guys wanted to do the elbow bump. And so my thing is, no, first of all, we sitting far from each other. Everybody got a mask on. We're not touching, we're being very careful in terms of how you enter a door and leave a door, space for people to get in and out. Nobody's bumping up and rushing. And then mask must be on at all the time. And finished the meeting, bump. I said, nah, not even doing the elbow bump. That's too close. Period. Right. And so the feedback I got from one of the guys was, oh man, you know what? And so I said, that's not good thinking. The right thinking is to really be serious about this. This is not a joke. This is not a joke. And just because you think we friends, I'm gonna bump your elbow. Look, brother, it's not gonna happen. No. So at some point in time, we have to develop that attitude that social distancing means social distancing, period. And wearing the mask means wearing the mask, period. And there's no, variation on that thing. You got to do it. And so, Carolyn, do you see more of us doing that now? Or are we really falling into believing that this is real? Are we still resisting it somewhat?
I think some young people and some older people are still resistant. I go in Target and I see the arrogance of some walking in with no mask, like, I dare you to say anything to me.
Yeah.
And a lot of times it's a man, and a lot of times it's a European male. And it's like one guy had a thing on his a sweatshirt that says, I know my rights. So, they're listening to Trump, and he's killed more people than the law allows. We're almost at the 250,000 mark now. And how many people from those super spreader events who go back to their towns, and we're talking small towns back in, where they may have a hospital 50 miles away, and 2 supposed ICU beds. So what I've been reading are most of those hospitals are overwhelmed. And in the Dakotas, they're sending some patients to other states nearby because they have no ICU beds.
Wow.
And it's like, why isn't this information getting out? Because if the mayors of those towns, if the hospital, the president of the hospital was allowed on TV, and every day they did a report on, this is what's going on at our hospitals. We have no beds. We are overwhelmed. We have had this many people die waiting to get a bed in the ICU, but we can't help them. We are overwhelmed. Please, please, please wear your mask. Please social distance for your own life's sake and your families. Please do this. But nobody's doing that. So people ignorantly go about their business, talking about their rights, but you don't have a right to kill others.
No.
You don't have that right. And you are like an atomic bomb going from person to person with your poisonous self, spreading a deadly virus because you know your rights. You really don't have that right. If we had the right person in the White House, we'd have more enforcement like they do in China and Korea, and I hate to say some other places, where we've got more people dead than they do in China. What is China? 6 to 8, no, it's bigger than that, times our population. And there we are overshadowing them with 250,000 people dead. That's crazy. And how many million infected? That is insane.
Yes,
I
we
think
try.
the information is key, it's critical, and this reminds me to do something that I set out doing but didn't achieve yet, but need to. One of the things that you said is paying attention to the impact of COVID-19 infections and death and spread in Black and Brown communities. And what I do know, when I checked a couple of times, we got kind of informal data that the impact was Black and Brown. And the Brown included Latino and included Hmong. And but we're not, those numbers are not being presented on a regular basis where people get a sense of the gravity and the relative danger that we are living with. And it reminds me that once I talked to one of the African-American women who lead a major health institution here in our city. And she talked about some years ago when she was doing work on the AIDS, HIV prevention, that one of the administrators, when she questioned what the spread rate and impact reach was in the Black community, said, "Oh, we know the numbers, but we don't want to put the numbers out because we don't want to have the community get mad." Well, that's the same kind of logic that the president used, right? I know this is killing, but I don't want to panic the people. But the people need to know. So what I want to do as a consequence of this conversation, Sherlyn, and you have to remind me, and Carmen, you can help me, is reach back out to Ramsey County and Hennepin County and specifically, again, assemble the data on the impact of HIV, not HIV, but COVID-19 in the Black, Latino, and Hmong communities, primarily in Ramsey and Hennepin County, and be able to put that information out on a regular basis, weekly, so that we have the numbers, and we talk about that on this program every week as well. Sherlyn, let me switch gears a little bit because it's all the same thing. It's all about public policy. And you are taking the fight to another level by throwing your hat in the ring, looking for election to the city council for the city of Maple Grove. Talk about your decision to do it and where you stand and what you want people to do to support your candidacy.
Well, a lot of my friends say, "Oh, you should be Miss Maple Grove. You're always talking about it and you love it so much." And then I also discuss the things that need to be changed in Maple Grove. I've been known to sit in some of our restaurants. I go in for a bite, sit on the bar, and the people next to me start talking to me and we start chatting. And then some of the people next say, "You should run. I would support you. I like your ideas."
Perfect.
But if you want change, somebody's got to get in the ring to make it happen. We can all sit back and complain, well, they should do this, they should do that. Yeah, you're right. So what are you going to do to help encourage them to do this or that? Or are you going to stand on the fringes and complain forever? And unfortunately, that's been what most people do, is complain. They don't do anything to change the paradigm, to improve the conditions. So what I'd like to see happen, I'd like to see our city look more like the people who live here. We're a diverse community, becoming more diverse all the time. I'd like to see the police force reflect some of that diversity. And I'm not only talking about Black African Americans, I'm talking about Latino, I'm talking about Asian, I'm talking about Native, I'm talking about everybody who lives here. You should be able, when you go down to City Hall, you should recognize yourself somewhere in that building. And we need to have an officer of, what do you call it, officer for inclusion, to diversity and inclusion, to make sure that these offices and areas have been, I don't want to use the term integrated, but I guess I will, but there needs to be a cohesiveness to our city where everyone feels welcome, everyone feels heard. Our business community needs to feel heard. You know, there's a balancing act that has to take place between, especially with COVID, what's good for the community and our families and what's good for business. Now, the CARES Act gave money to communities, and I hope they release more, because I think we need to shore up our businesses so they can remain healthy until we get back to normal. But we will not get back to normal breaking the rules. We will have to hunker down and do those things that will get this virus under control. Hoping and wishing and being in rebellion is not going to make it so. It's going to make this pain last longer and longer.
Sherilyn, thank you so much
for
all that you do, for
Thank you.
and for your willingness to step forward to provide service and leadership, service through leadership. We close with Daniel and Carmen. Daniel, 5 things people should think about in just being safe, being aware, and being decompressed, not feeling stressed in the COVID environment. What would they be?
5 things.
Put you on the spot.
Yeah, I was like 5 things. To decompress, I would say one is very practical. It's well, I guess it'd be 2. I would say one is just be aware. So it's connect to what like Sherilyn said. Have a mask on. If you see other people not wearing a mask, maybe choose to remove yourself or distance yourself from them, or maybe say something. So just being aware. Then also too, like hand washing. If you see people you're out with, they're not taking safety precautions, say something. Say, you need to wash your hands, or be like, you need some hand sanitizer. Because I have friends where at the table, if somebody they weren't certain, they'll bust out a bottle of, literally a big bottle of hand sanitizer, just squirt it everybody's hand. That's being that's being aware, and it might you might think it's embarrassing. Be aware. One is another part in regards to mental health experience. One is be concerned, but do not worry. And there's a big difference.
Yeah.
Concern is, again, goes back to awareness. Worry is where it becomes anxiety, or it becomes an obsession, and that's not healthy. Another part is continue as much as possible within the parameters of what we're given in this situation. Continue your life as it was, but just with adjustments. And I think that's a big one for a lot of people. It's been difficult to feel that life can continue as it has. It still can. There just needs to be adjustments, and I think that's a really big one. Those are 3 that popped out at me. I don't have a 4 and a 5.
Those are 3 great ones. Thank you so much.
All right.
Carmen, I'm going to give the final word to you as you're thinking. En este caso vamos a usar español. ¿Qué piensas de esta conversación?
Me encantaría. Bueno, quiero darle gracias a los expertos aquí que nos ayudan a entender qué tenemos que hacer y hacerlo con amor y hacerlo con paciencia. Y como dice our council member here, ves algo, di algo. You see something, say something.
That's right.
And before we close, I wanted to tell our nurse here that my youth group makes masks. And so this is our latest one. It's Nurses Are Our Heroes. And so I would like to be able to send you some. I don't know if Mr. Mack, how you and Bobby like your masks, but that's one way to encourage people to wear masks.
That's right.
Is to create masks. I have a Dia de los Muertos masks. And so what we do is we share them with folks who aren't wearing masks. And that way they can give una expresión de su cultura, quién son, y para estar bien de salud. So muchísimas gracias. That's what Walter Mercado would always close with. Con mucho, mucho, mucho amor. Gracias, Mr. Mack.
Gracias. Thank you all. Listen, Daniel Plunkett, Sherilyn LaChapelle, Carmen Robles, thank you, all of you. We're doing this every day. If you've watched this program on Facebook, we want you to send your comments in, to like it, to share it, to watch party. This is an important conversation. And if you're checking us out on YouTube, we're trying to build a YouTube community. It's very small, but it's a beginning. We start somewhere. And we want you to subscribe and check us out every day when we're on at 1 o'clock, and tell your friends so we can build an audience on YouTube and on other social media as well. I'm Al McFarlane. This is Conversations with Al McFarlane. We'll see you next week. Take care.
Adios.
Thank you all.
Thank you.
Yes,
Bye.
yes. Cheryl Lynn, we need to connect at some point.
Absolutely. I was thinking that.
Yes, mi amor, porque Maple Grove, Maplewood, it's Ramsey County, is it not?
No, we're Hennepin, between Brooklyn Park and Plymouth.
Okay.
That's where we sit.
It's
Yeah.
a little bit more challenging, but no big deal.
No big deal. You know, I go everywhere. From Chicago, like Daniel.
New
I
York,
drive.
Brooklyn. Thank you so much. It was such wonderful to meet you.
You too.
Like I
You're
said
very
before,
lively. I love it.
Yeah, what can I say? You know, when you face death, you want to be alive all the time.
I agree. I agree.
And it's important to have your message, because you're one of the scientists that you're not into marketing, you know, hey, buy this thing, but you're giving us information to save our lives. And
Yeah.
so when a medical individual and like our psychologists here share this information and Mr. Mack's format to have a conversation, that's so powerful. Because my family, we don't listen to CCO, and we like to we just forget to hit like and subscribe and everything. But it's important what you're saying, and however I can help support your candidacy, please
Thank
let
you.
me know. I'm more than happy. I look forward to it, because we need this leadership that has the gumption to say, hey, lift your mask. My beloved aunt in Puerto Rico, who just passed away, a nurse. And so I see so much of her in you, and I want to, even the hair and everything.
Oh boy.
Oh, sí, bien chévere.
Yes.
So count on the Latinos for you in down
Thank
there,
you.
Hennepin County, wherever the heck you are. And please let me know
I
how you
will.
would
Thank
like me
you,
to do.
Carmen. Thank you.
Whatever I can do.
appreciate you, my sister.
Oh, mi hermana, same here. We
You
need
could
that.
you
that
could put
sisterhood.
your contact information in
Yes,
the
let me do
chat,
it in the
or just
chat.
take it over. Yeah,
There I am.
yeah, and then
Yeah.
we can have it.
And so how do I get it though?
Chat.
Go to the chat on the bottom of your screen,
Yes.
and you'll see messages or notes there, and so you can get Sherilyn's information there.
Okay, now I'll send you mine. Oh, I love this high-tech stuff.
Right.
Yeah, I only wish I knew what I was doing, but otherwise I really like it. Okay, 612-382-0431. Yeah, and so I'm working a lot with youth now. I'll be working with a school in Little Canada.
Oh, okay.
Yeah.
I was on the board